Good evening, everyone, and welcome to our joint session between the International Society of Cannabis Pharmacists and the Illinois Pharmacists Association. Illinois Pharmacists Association program entitled tonight, Weeding Out the Truth, the Pharmacist Role in Medical Cannabis. Tonight we are joined by myself, Garth Riddles. I am the Executive Director of the Illinois Pharmacists Association. We also have Starlyn Hayden Greeding, who is our Director of Clinical Programs and Population Health, and our speaker this evening, Dr. Kelsey Schwander. And we'll be going through her bio here in a minute, but I do want to just take a moment to welcome everyone. Glad to see that we've had so many join us this evening virtually, and sorry we couldn't have more in person. But this will be the first of many events in going forward in the future as we continue to talk about this ever-expanding role for pharmacists. But I do want to go through and give the little background on our speaker this evening. Dr. Kelsey Schwander received her Bachelor's of Science in Pharmacology from the University of California at Santa Barbara. She then completed her Doctor of Pharmacy at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. After graduation, she completed a postgraduate Year 1 community pharmacy residency at the University of Colorado and Good Day Pharmacy. After her residency, Dr. Schwander became the lead pharmacist at Good Day Pharmacy, the largest independently owned pharmacy chain in Colorado. Dr. Schwander has her clinical cannabinoid medicine certification and is experienced in discussing cannabis with patients due to her past clinical work in Colorado. She started her own consulting company through which she provides specialized medication counseling, including cannabis education, gives lectures, and assists patients, providers, and businesses in creating practical healthcare solutions. She has spoken at numerous conferences, podcasts, and webinars on the topic of medical cannabis from a scientific point of view. And Dr. Kelsey Schwander is a clinical assistant professor in the Department of Pharmacy Practice at Southern Illinois University School of Pharmacy. And she practices as an ambulatory care pharmacist, providing chronic care management to patients at HSHS Medical Group in O'Fallon in Shiloh, Illinois. And I'll turn it over to Dr. Schwander.
All right, well, thank you so much for both organizations for having me tonight. I really appreciate it. There'll be time for questions that you can ask them in the chat. I probably will, I can kind of see the chat, but Garth, I may have you keep an eye on it for me if I miss things. And at the end, we'll make sure to leave lots of time for questions. I did want to start off just because I know this was open to two different groups. In the chat, if you could just write maybe where you're from or where you are right now. And if you're a pharmacist, if you're a patient, if you're just curious about the topic, if you're a caretaker, just so kind of I have an idea of who is on the call. If you don't mind just taking a second and sending that. And I don't know, Garth, if you are seeing pop-ups, if you can maybe just, or actually, I think I can, there we go.
Yes, we have a pharmacy student, and I know we have a couple of pharmacists also in the attendance.
Okay, so yeah, so it looks like mostly pharmacist based, which is good, but I know some patients or caretakers may view this as well, and I think it'll be a good topic for everyone. So, all right, well, let's jump in. So just real quick, some disclosures. We are discussing non-FDA approved drugs and the uses of drugs. We have to understand that the data is very limited. And so we have to go off of the studies that have been done. Conflict of interest, I do own a consulting company, it's B-Health Consulting, which I will talk a little bit about later, where I do pharmacy independent consulting, but also cannabis education. And then I also help out with eHealth and do cannabis education videos for them as well. All right, so before we get started, I always ask this, and just for the sake of time, I will kind of just fill in the gaps here, but I always ask, who is using cannabis? Who comes first to mind? So just take a second to think about that. So usually when I present in front of a live audience, I get, people saying, oh, patients who are in pain, kids who want to get high. So when you first think about it, when you first get into cannabis, see, these are some of the images that may pop up into our mind. For me, my first exposure to cannabis was this guy, Snoop Dogg. Thank you to MTV in the 90s. But really, that was my first exposure. I was like, people use cannabis or use marijuana just because they want to get high. So this is kind of the idea that we have in our head. And so I like to sit back and think, okay, so what are the patients who are approaching us with questions? What's the demographic that we're looking at? So the fastest growing age group in the United States right now, according to the CDC, is our 65 and up group. So it's really not the younger generation. They are the largest user, but the fastest growing age group is really 65 and up. For gender, it's pretty even. Males are outdoing the females just a little bit, but when the new data comes out, the CDC hasn't done a report in a while, but I feel like when it comes out, males and females will be pretty equal. And then race, so Black, Hispanic, white, what are we thinking? And it's actually white. So when we think of our patients, this is really the demographic that we're going to be looking at. Obviously, there's a lot of people using cannabis, but it's really the patients who I work with and who I have talked to really are our patients who are older, who are on a lot of medications, and either they are not experiencing relief from their medications, or the medications are giving them side effects that they don't want, or their only option is a medication that they're really concerned about and they're looking for an alternative. So really these patients are kind of at their wits' end and they're really looking for help, and they really would like to speak to someone really from a medical background. And that's where I think pharmacists can really come in. Let's see here. All right, so I would like to put this out here as well. So the majority of Americans support legalized cannabis, true or false? So you guys can put it in the chat. Again, for the sake of time and me toggling back and forth, I'll just give you guys the answer. So in 2020, at the end of 2020, they did a survey, and it was the first year that 68% of Americans supported legalized cannabis. So the majority of Americans, that was the first year that they support legalized cannabis. In 2020, so this was published in January of 2021, the legal sales in the United States reached $17.5 billion. I just checked recently, and as of December 2021, states have reported just the tax revenue, so not total sales, but just a tax revenue of $10.4 billion. So I have this information here for you because this industry is not going away. A lot of our patients are using it, and there's a lot of money involved, and it's about time that we start getting involved to help our patients. All right, so what is the pharmacist role? So it's really time for us to put, our beliefs and stereotypes to the side and really focus on patient safety and open communication. So, despite that, cannabis is still federally legal and there is a lack of strong evidence for its use, our patients are going to be using it if we agree with them using it or not, or if we agree with cannabis or not. And it's really our job to educate them so they can make smart and safe decisions before they use cannabis. And that's where really we can help our patients. All right, so I'm going to briefly go into the history of cannabis. So really, how has it become a new therapeutic alternative? I'm going to briefly go into the background, but cannabis has been around for a really, really long time. Cannabis is pretty much the only drug that was used medicinally, then you take in saying, oh no, we can't use this medicinally, and now it's being used medicinally again. So just to point out a couple key dates, but back in 2900 BC, that was the first recorded use of medical cannabis. And so in a Chinese emperor, there was noting that it balanced out the yin and the yang. Fast forward to 1850, it was actually added to the US Pharmacopoeia, and it was actually patented as a tincture, and there was about 20 indications that it could be used for. Now, not too long later, we start to hit the Prohibition era. So this is kind of when the culture and the tides change, when we start banning alcohol, and a lot of states start banning cannabis as well. So there's the Tax Act, and then eventually it's removed from the US Pharmacopoeia. And as we all know, in 1970, the Controlled Substance Act classified it as a Scheduled 1, meaning that there's no medical benefit and high potential for abuse. So it kind of changes now. Then in 1985, dronabinol is FDA approved, which is very similar to the THC molecule. In 1992, the first endocannabinoid was discovered. Now, this is important. I have this on here because if we think about our cardiovascular system, other systems in our body, we've known about them for much longer. So we're still learning a lot about the endocannabinoid system. Then we have some legalization, and fast forward, the Farm Bill in 2018 is signed, legalizing industrial hemp, which we will go over. And to date, there's 18 states that have legalized recreation, and about 36 states that have some form of medical cannabis legalization. I pulled this map today. So this is just kind of the United States and the different types of legalization. So full legalization, medical and decriminalized, medical, CBD only, and then fully illegal. I have this map on here because it's messy. Every state has their own laws, their rules, their regulations. It's confusing for our patients, it's confusing for providers, and it's really confusing for us as well. So it's really important that we keep up to date with it and what's going on in our state. So just real quick, because I'm presuming most of us are from, practicing in Missouri and Illinois. So this is what legalized it. So in Missouri, it's Amendment 2. And so this just allowed for medical use. It allows a physician to certify a patient for a qualifying condition, which allows them to have 4 ounces in 30 days, and they can grow 6 plants at home. On the Illinois side, we had the Cannabis Regulation and Tax Act, which made recreational cannabis legal. If you're 21 years and older and a resident, you can buy 30 grams of flower, 5 grams of concentrate, and 500 milligrams of edibles. Now you're probably curious, a lot of you on the Missouri side are saying, hey, my patients just drive over, how can they buy it? You don't have to be a resident to buy it. You just cut all the amounts in half. So they are only allowed to buy half the amounts. And there's some other things that Tax Act did as well. And then briefly, the question I get a lot, are we going to have federal legalization? So there was the Cannabis Administration and Opportunity Act, and pretty much are trying to remove cannabis from the Controlled Substance Act and treating it more like alcohol versus a drug. There would be a federal tax. It would allocate money for cannabis studies. And the biggest proponent for this was Amazon. At the end of last year, this act didn't really go anywhere. And I actually checked recently, and really they're recommending, before we federally legalize it, there are a couple other acts that we really need to be focusing on. And one of them is the Safe Banking Act. I'm not going to get into that, but as we know, because cannabis is federally legal, any money involved with it, a lot of banks won't accept it, and it's just very messy. So they're trying to kind of figure that out first before federal legalization. Now, do I think federal legalization will happen? I do at some point. I think there's a long way to go before Amazon starts delivering cannabis to your door on, your Prime account. But hey, crazier things have happened. All right, so now we're going to get into cannabis pharmacology. So we're just going to get into the basics. Not too into the nitty gritty, but hopefully this will give you just a little bit of a foundation. So let's start. What is cannabis? A lot of people are saying, when you hear that word, what does it mean? And so I kind of call it the overarching term, the umbrella term. It's kind of the new sexy term. Marijuana really isn't used anymore, but hemp or cannabis is really referring to the flowering plant. The Cannabis sativa is the main species. There's Cannabis indica, ruderellus, and many, many, many other subspecies. I have a lot of patients ask me about different species and strains and hybrids. And I tell my patients that is not my specialty. I know how it works in the body. I know about drug interactions. I can educate you so you can make smart and safe decisions. But we really need to be talking to the bud tenders and things about that. But what I will say, which helps, my students always remember it, is so cannabis sativa is one main strain. And one way to remember it's more activating, more uplifting. And so sativa, a way to remember is stay up all night. And then cannabis indica is really the other big one that's used. And it's more sedating, more calming effects. And so indica is into couch. So silly way to remember it, but hopefully you'll remember it now. We have to remember the plant has over 400 compounds in it. The cannabinoids are the ones that we're finding that have the most medical benefit and the ones we'll be talking about tonight. Terpenes you're going to hear a lot more about. One of the dispensaries I work with really focusing on terpenes, and they're the essential oils of the plant. They're responsible for the aroma, the flavor, and they're finding that there is some medical benefit with them. And terpenes are also in like regular plants as well, like lavender, that the smell that comes off that has a calming effect. So it's not just unique to the cannabis plant. Marijuana is really referring to the dried leaves, flowers, stems, the trichomes, which are the buds and the seeds. And then industrial hemp is what was passed at the end of 2018. So it's derived from cannabis sativa at much lower THC concentrations. Now, the products that are made from industrial hemp are supposed to have less than 0.3% THC. I'm not going to get a lot into CBD tonight and the regulation of it, but it's really important when you are purchasing CBD for your pharmacy, or if your patients are asking about, is to really buy a good quality CBD, because unfortunately this industry is not regulated very well. You have to be really, really careful with the products that you purchase. All right, so what are the types of cannabinoids? So I kind of like to group them into three buckets. We have the phytocannabinoids, which are derived from the plant. So that's our delta-9 tetrahydrocannabinol, which is THC, and cannabidiol, which is CBD. And then we have the endocannabinoids. So our body makes their own endocannabinoids, so anandamide and 2-AG. And then the third bucket is the synthetic cannabinoids. So things that we synthetically make, such as dronabinol or marinol. So the endocannabinoid system is another biological system in our body. So just think about, the cardiovascular system, the respiratory system. So it's made up of neurotransmitters, which are endocannabinoids that bind to cannabinoid receptors. So our CB1 and CB2 receptors. There are a lot of other cannabinoid receptors that we're finding more and more medical benefit, but tonight we're just going to focus on the two. So the cannabinoid receptors, we mainly have our CB1 and our CB2. So our CB1, so if you look at this person, hopefully you can see my mouse, but if you look at the dark purple, this is where the CB1 receptors are located. So we're thinking about the brain, the spinal cord, the peripheral nerves. And this really comes important when we talk about the binding. So CB2 receptors are mainly found on our immune cells. So these are the light purple on this little person here. And so this is really located in our spleen, our immune cells, and our inflammatory system. So our endogenous cannabinoids bind to our CB1 and CB2 receptors in our body naturally. So anandamide are really responsible for our motivation, pleasure. 2-AG is responsible for managing appetite, pain, and our immune system. And those sound similar to the effects of THC and CBD because they mimic the molecule. So the phytocannabinoids, so we have our THC and CBD. So our THC mainly has highest affinity to our CB1 receptors. Now this is important because remember, the CB1 receptors are mainly located in our brain and our spinal cord. So that's why we have those psychoactive side effects from THC because of the location of the receptors. One thing I would like to note is that there is practically an absence of all CB1 receptors in our brainstem nuclei in the medulla oblongata. And I point this out because that is where our respiratory system control center is. And so you cannot have respiratory depression with THC. So it is okay to use THC and opioids together, you have to be careful because of the other side effects, but you can't increase the risk of respiratory depression with THC. And that's why people don't overdose on THC. It also partially binds to our CB2 receptors. Our CBD now, the CBD mainly binds to our CB2 receptor. So again, that's why we're finding CBD is helping with our immune cells. So inflammation, pain, arthritis, things like that. And then it also partially binds to the CB1 receptor as an antagonist, meaning that it kind of offsets the effect of THC. So frequently you're going to see more and more products come out with THC and CBD, because when we have THC, we want to hit those specific areas. And then when we add CBD, it actually helps lower those psychoactive side effects. So that high feeling, which a lot of our patients, most of them don't want to have that high feeling. They just want to have the medical benefit. So briefly, I'm going to go into the pharmacokinetics. This is probably the most important slide as pharmacists that we can help educate our patients before they walk into a dispensary. So I'll briefly go over this, but obviously there's lots of different routes of administration. We have inhalation, ingestion, mucosal, topical. We have the onset of action, the duration, and the bioavailability. So let's get into inhalation briefly. And so can you guys see my mouse? So you can, okay, perfect. So this graph is the graph that we're gonna focus on for inhalation. So we have to look at different metabolites. So we're gonna be looking at this dotted line here. And it kind of looks like an IV bolus. So the onset is immediate. It takes just a couple minutes for the patient to feel the medication, and the duration is about 2 to 4 hours. So the nice thing about inhalation is that this graph is pretty predictable. And our patients can titrate their dose really easily. So they can start at a really low dose, and 10 minutes later, if they're not having the effect they want, they can increase the dose. And the bioavailability is about 10 to 35%. And so obviously as pharmacists, are we going to be recommending patients, smoke or inhale cannabis? It's the pens and things that are out there, we have to be really careful with what they use in the cartridges and the flavoring. And those are the things I'm more concerned about. There's been lots of studies done, and there has been no recorded increased risk of lung cancer with cannabis. It's mainly the additive effects in the cannabis vape pens and things they add to it. But it is really a good way for our patients to dose themselves. Now, ingestion is mainly what I would say my patients would like to do because they really don't want to smoke. So when we look at ingestion, we're going to be looking at this graph here. And because we have to look at different metabolites, we're going to be looking at this thick line right here. So ingestion, the biggest problem is the onset of action. So it can take anywhere from 30 minutes up to 2 hours for the patient to feel any effects. So the pharmacokinetics is really unpredictable. It lasts a really long time, and the bioavailability is much less than inhalation. It also depends on what the patient ate that day. THC is degraded by acid in the stomach. There's an extensive first pass liver metabolism. So lots of different variables we have to factor in. I have a lot of good stories about my patients and ingestion, which I don't have time to talk about tonight, but we can't stress enough, start at the lowest dose and you're going to have to wait, anywhere up to upwards of 2 hours to feel the effects. So they really need to be careful. And then we have mucosal. The onset of action is pretty quick. So 15 minutes up to an hour, 4 to 6 hours, and the bioavailability is there. Topical is always a good option for localized pain. The onset of action is about 15 minutes. The duration is the shortest, and the bioavailability is not there because it depends on the vehicle it's in, cream, oils, things like that. I will say I have a couple patients who do use the topical, and they do say that they really do have to reapply it every couple hours to have the effect that they want with it. All right, so getting into the pharmacodynamics, again, we have to remember that I'm just talking about 2 of the cannabinoids in the whole plant. So there's a lot of other factors that could produce other effects. So CBD, some beneficial effects. It's an anticonvulsant, can be an anxiolytic, antipsychotic effects, neuroprotective. Again, what I was mentioning earlier, if you add it on to THC, it can actually decrease those psychoactive side effects. So the high feeling that patients may not want to experience. Adverse effects, diarrhea, dizziness, drowsiness. Now we have to remember that this adverse effect could also be a beneficial effect if a patient wants to use it for sleep. Liver injury is something that I think we don't think about a lot. I think this is a huge place where pharmacists can come in. If a patient comes up to the counter but has CBD and an oral CBD agent, we should be asking our patient, has anyone ever told you that your liver doesn't function properly? And if they say yes, then we should say, hey, we need to talk about this. And then THC, obviously an antiemetic, appetite stimulant, muscle relaxant. And then some adverse effects, we have that euphoria. Hyperemesis syndrome is really one of the only reasons we send our patients to the emergency room. Another name of it is called cyclic vomiting syndrome. And it's really when for chronic users and they have nausea and vomiting and abdominal pain and polydipsia. And we really need to send them in because they need to get IV fluids and some antiemetics. Very rare that happens, and it's usually just in chronic users, but something to be aware of. And then again, we can have hypotension, the psychoactive side effects, and then tachycardia can happen with some patients, so we need to be mindful of that as well. All right, so I always get asked, well, what's the data? Again, we have to remember that because it's federally illegal, the studies are not as robust. But I did, try to create a list here that we're seeing some really good benefits. As more and more studies are coming out, as the laws hopefully lax a little bit more and we can really focus on studies. It's always, good to look up studies when I have patients who come to me and ask, hey, I want to use cannabis for X disease state. What do you think? I tell them, I'm going to pull a couple studies, but we have to remember that in this one study, there was maybe only 10 patients. So again, we have to use what we have, but hopefully more and more data will be coming out. All right, so now that we have a nice little basis, quick foundation of how cannabis works, and some things that we can educate our patients on, what is our role in cannabis? Where do we fit into all of this? So I always like to talk about this with my pharmacists. We're always so proud because we always rank near the top of the most trusted healthcare provider every single year in surveys. And, we're the most accessible healthcare provider to all of our patients. We're right there. We're in the pharmacies. They can just walk up and talk to us. So I always use this example. So if a patient were to come to your pharmacy or clinic or wherever your practice site is with a bottle of Tylenol, and they said, hey, how do I take this? Do I have any drug interactions? What should I expect? If the pharmacist said, oh, I don't know about that drug. I don't really believe in that drug. How about you just go on the Google and look up a couple things? What is that patient thinking? What does that say about our profession? So, I use this example because as pharmacists, we have CBD in our stores. It's everywhere. It seems like, our patients can get it in the grocery store. And so when a patient comes up to our counter, asks us these simple questions about the basics of this drug, we really should be able to answer them. And, I think, as a profession, we really need to help support our patients and be able to, educate our patients appropriately. So really, I think we need to have basic education so we can counsel our patients appropriately. We should know drug interactions, and we should figure out how we can get involved into patient care. And I've said this before, despite it being federally illegal, despite some of the studies not being as robust, we truly are doing a disservice to our patients if we're unable to educate them and make sure that they make safe and smart decisions moving forward if they choose to use cannabis. So patient education. So really, I just, when I tell my students, I say, think about just any drug, how does it work? what should I expect? Side effects, when should I go to the ER? Can I take it with my other medications? These are questions that you should be asking yourself as a provider. If you're unable to answer these, you should probably go do some homework. Hopefully, with what I just gave you, you should be able to answer some of them now. But these are questions we really should be able to say to our patients and to make sure our staff, all the pharmacists know some of these answers. Drug interactions, I could spend 2 hours on drug interactions. This is a very, very brief overview, but metabolism primarily occurs in the liver. And so a lot of CYP interactions, there's P-glycoprotein interactions, there's glucuronidation interactions. And so look it up. Luckily, a lot of our resources now, we can use it. CBD, we have to remember, Epidiolex is an FDA-approved CBD formulation. And so you can put Epidiolex in. Yes, it may not be the exact dose and everything, but we can check those interactions and tell our patients. A lot of the drug resources too now have THC as well. So again, that's a good place for us to start, to look it up. So you start getting familiar with some of these interactions and figuring out, when we need to really talk to our patients and see if they should be using CBD or cannabis. All right, so how do we get involved into patient care? So for me, I just wanted to give a couple examples. I'm an ambulatory care pharmacist, so I work in a doctor's office, and my health system allows our physicians to write for medical cards. And so I would get referrals, before patients were starting opioids or if someone was interested in a card. And I get asked a lot, like, I can't believe you wrote this in your EHR, how did you go about this? Because we need to protect ourselves as well. So, we always want to make sure, is your health system okay with you documenting this and talking to your patients about this? And hopefully they are. But I always have this little blurb I put in, and, I say, I tell my patients, it's not FDA approved. I'm not recommending its use due to lack of evidence. However, I'm going to educate you so you can make smart and safe decisions. And this is mainly for THC. And then, I do have a consulting business, and I did put this in here because I am still shocked about how many requests I get from patients, dispensaries, businesses, healthcare providers, really just to educate from a medical standpoint. And I really feel like all pharmacists should be that resource for our providers and for our patients. So just some other involvement that you may not know pharmacists are in other states. So in Connecticut, a pharmacist has to own a dispensary. They're the only ones that are allowed to own dispensaries. There has to be a pharmacist on site in New York, Pennsylvania, Minnesota. There has to be a pharmacist consultant that they can call in Arkansas. And then in Louisiana, it's actually regulated by the State Board of Pharmacy. So there's a lot of different states that are doing a lot of unique things, getting their pharmacists involved because it's a drug and we are the drug experts. And we really need to be getting involved to make sure our patients are, being safe. And then always, involve our technicians and students. Obviously, I'm a teacher, so I love getting my students involved, but use your technicians, use your staff. They're the ones who are patient facing. When they're going over medications, ask your, patients, are you using CBD? Are you using cannabis? Educate your staff. What is the difference between THC and CBD? If you have CBD products in your store, your staff should be able to articulate, what is the difference about the products? What's the difference between full spectrum, broad spectrum, isolate CBD? I know we didn't get into that tonight, but things like that are, technicians and students can help out with. And then pharmacy students, they can really look into the medication interactions and really educate on safety. And lastly, so I always take my students to a dispensary. If you're a pharmacist, if you're, just interested in cannabis, go to a dispensary. You don't have to purchase things. Everywhere I go, whenever I travel, if there's a dispensary, and obviously it has to be recreational, I go up and I say, hey, I'm a pharmacist, I'm not going to purchase anything, but is it okay if I come in? I really just want to see what your store looks like, the education you're offering, and what products that you have, because I want to know what my patients are using. And so I think it's a great experience for our students to go into a dispensary so we can see what our patients are experiencing. And I always tell my patients too, if you walk into a dispensary and you're uncomfortable or you think the staff's not educated, you can leave. You don't have to purchase anything. You can go to another dispensary. So again, really just being aware of what our patients are walking into is really useful as well. All right, so that is it for tonight. Hopefully it was a good foundation for you, but I'm open to questions. I think I see some in the chat. Let me try to open them. And I don't know if people can unmute themselves.
If they raise their hand, we can unmute them. But you can put your questions into the chat or into the Q&A. Hit the Q&A button and place your question there as well.
I just was going through a bunch of my newsletters and something popped up about they're studying the effects with autism. I didn't know if you knew anything about that.
I haven't read too many studies about it, but I will say I had a patient when I was working in retail. We had just CBD in our store, and we had a patient who the father, he was running out of options. He didn't know what to do, and they started using CBD, and he said it helped them tremendously. Obviously, I think being realistic with our patients too, like this isn't going to cure you or this isn't going to, get rid of all of your symptoms. But again, if it helps our patients and, the father would come in, all the time and purchase it, he, couldn't thank us enough. And, again, we educated him appropriately on how to use it and titrate it and all that stuff too. But yeah, so I haven't read anything too recently about it, so I should look that up, but I have seen it work well in at least one patient.
And they've opened up some areas. Is it in Connecticut that they're opening up the ability, doing more studies through thought I read that too.
Yep. So Connecticut, they're really kind of ahead of, the pharmacists have to be the owners, which I think has a big influence because they're, we're all obviously like, let's study it. So it'll be really interesting to see some things come out there. I don't know how they got around the legality of it, but good for them. I'm excited to see what comes out. Any other questions? And I have my information there if a question comes up afterwards and someone wants to get a hold of me too.